All right. Good morning. It's afternoon. We used to do these at 10. I think I did this on the last one where I'm so used to it being good morning. Good morning, Christine, and everybody out there watching or coming in the future to watch this video. We've got a really great guest today. Christine Dillon is with us, and she's going to be talking to us about her role as the director of the Children and Family Services at North Country Community Mental Health. And she's going to be kind of discussing specifically services available for autistic children and how that kind of plays out, because North Country Community Mental Health is a huge agency, huge number of services, so we could go on for ages and ages about what happens there. But Christine, welcome.
Thank
Thank
you.
you. I don't know if you want to introduce yourself. And if anybody's here watching live right now, which I can't see who's here, but I can see that some people are here. So if you want to chat in the chat box, you can put questions, ideas, thoughts, whatever's going through your head, stories of services you've used, anything like that. And also just, say hi. We like to see who's watching today. So at any time, pop in there and let us know if there's something you want to know. So, Christine, welcome, and tell us a little bit about yourself before we get started.
Great. Thank you so much, Jean, and thanks for this invitation. I'm super excited to be here. And I am the Director of Children and Family Services with North Country Community Mental Health. We're a pretty large mental health organization here in northern Michigan. We serve 6 counties. So we serve Sheboygan, Emmett, Charlevoix, Antrim, Kalkaska, Otsego, and everywhere in between. And so it's about 3,000 miles. It's a large area of land. We have about 250 employees, and we do all kinds of things for all kinds of people, pregnant mothers all the way, for people in their 90s. And so today we're focusing on autism, which I'm super excited about. That's a passion area of mine. And I've been with CMH for 17 years, but this is my 30th year working with children and families, particularly with autism. It's my specialty area. And I started out, even though I'm from Charlevoix, I lived in Los Angeles for a long time, and I started out working for the Institute for Applied Behavior Analysis, doing behavior analysis work. So I've been doing that for a long time, and I am a behavior analyst. I also have my master's in counseling. So I have been working with kids with all different ages. My 10th year doing evaluations and working just about in every part of the agency. And so that's me.
And
I
I
have
mean,
5 kids. I have
beyond that, I was going to say, beyond that, you have a whole lot of experience as a mother.
Yes, we have 5 children, and so 3 of our kids are on the spectrum. So I have a lot of knowledge in different ways too, just of being a mom, not only somebody that went to school for understanding autism and how to work with kids and families, but I am a family of people with autism. So
Awesome. Welcome. Yeah, your perspective on all these different levels is really appreciated and valued, and wonderful to have as the head of this whole program in North Country Community Mental Health. So yes, we have a lot of questions for you. And I'm not sure if Caitlin is here watching today, but we have a parent leader in our parent coalition who's kind of been really pushing this specific live event forward to get this information out. So, Caitlin, if you're in there, hello. And she's kind of helped us curate some questions that she's had dealing with, the system and her family and how they've been going through it. And she's been a part of this with Christine and I. So none of this is a surprise to Christine, but we've been discussing this. And a big thank you to Caitlin for making sure this went on. And we appreciate everybody else here. If you're here, I see you. Just pop a hi in there, and then we'll know who's here. We can speak with you if you have questions. Make sure you let us know. So I don't really know where to start, but I feel like as a parent, so I'm just going to come at this as a parent who's maybe got a child, and I have concerns about whether they, might have autism, be autistic. I want to use the right term. So, Christine, when we talk about somebody with autism, we say an autistic child, Correct.
You know what is so great? It just depends on the person.
Okay.
And I'll tell you right now, probably 5, 10 years ago, there would be these big theoretical debates
Mm-hmm.
about person first or label
Mm-hmm.
first. And what is really true is it depends on the person. Some people might say, I'm Christine and I'm autistic. Other people might say, I'm autistic and my name is Christine. And it really is up to that person and what they prefer. There are people, children included, that feel very strongly about them being autistic first and then their person second. So it's just, you really just ask. Just ask. Don't be afraid. Ask people what they prefer.
But we want to be clear that we don't have autism. Correct? Is that we are autistic? If we Does that make sense? Is that kind of a we don't say I'm Christine, I'm a person with autism.
Well, some people do. I
Okay.
mean, I wish I could say that there are any hard and fast rules, but there's not.
Okay,
And
so it's a
really,
preference.
it is a preference, and I'm a part of a lot of different autism communities, and for people that are adults and newly diagnosed, people have been diagnosed since they were very little, and it really is personal preference. And I think there are still people that prefer to have the label of Asperger's, even though that's not in the DSM anymore. And it really is a personal preference for what makes them feel comfortable.
So as I go through this discussion, I'll do my best to try to be find that preference for people, and want to respect everybody's individual wishes on how they prefer to be perceived and discussed. So um, thank you for some of that feedback and information. So as a parent, let's say, I might have some concerns about my child's development and think maybe they're on the autism spectrum. What what do I do? Like, do I go to CMH to get a diagnosis? Do I go to my doctor to get a diagnosis? What's kind of the general pathway? I'm sure, again, there's no hard and fast rule about what works, but from your perspective, with CMH, like, how would I go about doing that?
Sure. So as a parent too, so the first thing that I recommend to people is to go to their doctor, go to their PCP, whomever that is, to talk with them first thing, because there are an awful lot of things that can look like autism that are not autism. So, and this is from probably working with 400 or 500 autism kids with autism over the years. That pretty severe ADHD can look like autism, trauma can look like autism, speech and language issues can look like autism. That doesn't mean that children can't have both or all,
Mm-hmm.
because sometimes they do. But we want to make sure that we always rule out medical first. And that's just a hard and fast rule for what we do as behavior analysts or doing diagnostics for children. We want to make sure that, first of all, their hearing is intact. They are able to hear, they're able to see. They don't have any sort of a medical diagnosis that would be causing that concern. So we get referrals kind of in a myriad of different ways, but typically we will do autism testing once it has come through a PCP. So the PCP or the physician or pediatrician has what is called an MCHAT that they typically do at well child visits. That's at the 18 and 24 month office visits
Mm-hmm.
for well check for well child. And it's a parent form that you go through, and it doesn't take a long time, but it really looks at kind of those standard hallmarks for what you would consider to be classic autism features. Maybe not giving eye contact, not speaking before a prior age, not seeking out play or spending time with peers and things like that. And if there is a positive MCHAT, that's a pretty good indicator that this child might have a medical diagnosis of an autism spectrum disorder.
Okay.
So that's where I tell people to start. If you have any of those concerns, talk to your pediatrician about it. There's been a lot of education in the last 5 to 10 years for medical specialists of all kinds, psychiatrists, pediatricians, general practitioners, just to understand what autism looks like at any age. So that's where I would start. And then once, if you talk to your PCP and you still have concerns, then you can call our agency. So
Okay.
North Country Community Mental Health is part of Michigan Department of Health and Human Services, and we serve children and families with Medicaid. So they must have Medicaid in order to receive services.
Okay.
Sometimes people can have a primary private insurance like Blue Cross Blue Shield, um, or something like that, TRICARE, any of those primary insurances, and a secondary Medicaid, we can also serve them as well. People with just private insurance, we don't typically serve unless they're going to be receiving a waiver that is a pathway to Medicaid.
Okay.
Our autism waiver for the state of Michigan is not a pathway to Medicaid, but I can describe that in a little bit if you want. So
Yeah.
that's kind of where I would just very first start.
Okay. And so basically, if I don't qualify for Medicaid, CMH doesn't have will not be able to provide me services based on any level. Or
Correct. Well, what is true is that the Medicaid rules and private insurance rules are very, very different, specifically when it comes to autism. Most anything. But when it comes to autism, it's very, very different. So if you have like a Priority Health or a Blue Cross Blue Shield as your insurance, they will not accept any of our evaluations through MDHHS. You must go through your insurance company. So that first step is going to your PCP if you have private insurance, and if there is a concern and the doctor says, yes, I think there might be something there, or even if they don't and you feel like there is, you would contact your insurance company. And what is true for managed care for private insurance is that you can have 5 different people with 5 different Blue Cross Blue Shield plans and 5 complete different riders for autism. So if you are ever looking at services for your child for autism and you're even considering it, call your insurance company and talk to them about what they offer. Because typically, even in private insurance, the first step to getting services for your child is to have an evaluation. And every private insurance company will require you to go to a center of excellence. And a center of excellence is essentially like Beaumont, University of Michigan, Michigan State. Those are large hospital systems that do these evaluations and will require it from there. If you get it from us or someone just in the community, chances are they won't take it.
okay, well that clears that up. So it's basically the insurance company's needs,
Correct.
or what limits what CMH is able to provide since they don't
Correct.
accept it. Okay.
Right.
Yeah, that does clear that up. So if I do have Medicaid, I do qualify, and that's a whole different ballgame. How to qualify for that, that's a different talk. And I get a referral either from my doctor or I stumble upon your services there. What's that step look like? So I call you up, I email, what do I do to find out what?
Sure. And so that can happen a lot of different ways. We work really closely with our school systems in our area too. Sometimes teachers might have concerns, principals or a school therapist might have concerns, or a teacher, and they can call us, but we won't talk to them. Medicaid is always parent choice, and so for children who may be on the spectrum, the parent or guardian always has to call to request services. And so what they would do if you have Medicaid or primary first insurance and secondary Medicaid is you would call our access line. And that's right on our webpage. If you go, to our webpage, it'll show you that right on the top. And you think after all these years I have it memorized, but I don't. But I will say it. It's 877-470-7130. And what happens is that's that first step. You call in. You will talk to someone for maybe 15, 20 minutes. They'll ask for preliminary information, which would include insurance, name, what's the presenting problem. And if it is about autism, always say that in the access call. I'm interested in services for my child because I think they may have autism. And what that does is that triggers a pathway in our system.
Okay.
So if that's the case and they think, yes, you're probably going to meet criteria for our services, criteria would be you have to be in our catchment area in those 6 counties. You have to have a form of Medicaid, and you have to either have an intellectual developmental disability or an autism spectrum disorder or presumed autism spectrum disorder or a serious emotional disturbance that you could meet criteria.
Okay,
So,
I'm not sure. I'm not sure. Maybe you can answer this question in the chat from Caitlin. So when you have private insurance, you should go through them to get a diagnosis. Then you can come to
yes.
CMH after receiving a diagnosis to talk about getting the autism waiver and receiving
It
services from
depends
CMH
on
that way.
It depends on if you ever have that secondary Medicaid. So
Okay.
it sounds strange, but we don't really assist in people getting Medicaid. That's usually done through DHS partners, like through SSI or Department of Health and Human Services. So once you have Medicaid, then we can help you with that. The autism waiver is not a pathway to Medicaid. We have some other waivers that are pathways to Medicaid
Okay.
for folks that have private insurance, but the autism waiver is not one of
So
them.
can you maybe then just talk a little bit about the autism waiver when you say that, and then
Yes.
the other waivers and
Sure.
how that works?
You got it. You got it. So it's the autism benefit waiver was put in place in 2013.
Okay.
And for the state of Michigan. Many other states have had this for a number of years, but they put it in place as a waiver for children to get services because they recognize the need. Traditionally, applied behavior analysis has kind of been the gold standard, but there are many other supports and services that can be put in place for a child with autism that are beneficial. But traditionally, they'd be very, very expensive. So, like for instance, when I moved back here from California, I was doing contractually privately in private homes, very, very expensive ABA work, and people could only pay for it out of pocket. Even private insurance weren't paying for it. But what happened in 2013 is the state of Michigan put this in place so that if a child met criteria for a medical diagnosis of autism, they would be able to receive applied behavior analysis at no cost to them. And that's really what this benefit does.
So the waiver is basically, it's not a waiver for somebody without Medicaid to receive services
Right.
for their child. It's a waiver to get services if you have Medicaid. So it's basically they didn't even have services for autistic children available through through CMH through Medicaid. Is that kind
Right.
of? And I'm hearing
Right.
that. Okay.
Yes, and so applied behavior analysis is very, very specific, and so that is provided under that waiver. But we also, at our agency, provide a lot of services to people on the spectrum.
Okay. So the waiver is specifically for the ABA therapy.
ABA.
Okay. So that's that. It doesn't have to do with what insurance you have. It just has to do with a specific type of therapy that wasn't
Correct.
traditionally covered through
Yes.
Medicaid. Okay. So then you're talking about the other services, and I know the question is also about private insurance. We talk about that a lot. Is there a, because CMH has so many wonderful services available that are hard to find, outside of CMH.
Yeah. Yes.
So is there an option for people with private insurance but no Medicaid, like you talked about the pathways or anything like that? Is there an option to receive services somehow, or to how does that work? Is it just a flat out no, if you don't have Medicaid you don't qualify?
Well, for the autism, it would depend, and this is what I would say is that two of our major waivers that we provide that are not the autism waiver are the child waiver, and then we also provide the SED waiver, serious emotional disturbance waiver. So, for instance, the serious emotional disturbance waiver is for a child that is having a lot of behavioral disturbance in all areas: school, home, community. And so much so that they need to be psychiatrically hospitalized in order to stabilize them. That child typically is going to be a child who has a lot of trauma, but they could also have a diagnosis of autism. So if that is the case, that is a pathway to Medicaid for that family if they just have a private insurance.
Okay.
That is one waiver. Another waiver would be that CWP, the child waiver, and that is typically for children that have pretty involved co-occurring health concerns. So that
Okay.
would mean they might need a trach, they might need a vent, they need total care in their home in order to stay in their home. And they could also have an autism spectrum. That would also be a pathway to Medicaid services for
So
someone with private insurance.
it sounds like the kind of extremity, the level of extremeness, that's not the right word, of the diagnosis will have an impact, or how many co-occurring concerns this child is dealing with will have an impact on whether CMH can see them. Caitlin had a follow-up question
Sure.
about the autism waiver. So would that make speech or occupational therapy related to autism spectrum disorder free with the autism waiver?
So for the autism waiver through Medicaid for CMH services, if a child is school age, that speech, OT, and PT falls to the
The
ISD
ISD.
provide those services because it's during the school day. So, like for instance, if a child has Medicaid and they come through our services and they meet that criteria for the autism waiver and they get those services through school, if they have Medicaid, they can also go to some of our local hospitals, have those services available. Like for instance, through McLaren in Emmett County and Petoskey, the Denver Wellness Pavilion, they have OT, PT, and speech that someone might qualify for to get additional outside supports other than just what's happening in the school day.
Okay. So, and I'm reading the comments. I know they're always a little like slow, so we're at a lag time. So I'll keep checking on those too. Okay.
Right.
So I just, because I'm new, Caitlin's kind of an expert on this, and you clearly are. And I'm that new mom that doesn't know anything. So I appreciate the dealing with my naive questions, and what that means to be a waiver and what that means for my insurance and how that works and how I can get access there. So if there's more questions about that or if I didn't cover anything, pop those in the chat. So we talked a little bit about getting the waiver for the specific therapies. Well, I guess maybe, so if my child isn't school age, how is that different, I guess, with CMH? Is there an age limit, or as soon as a
Sure.
diagnosis
Well,
is available?
specifically for the waiver. So for the autism waiver, it really goes about 12 to 18 months all the way up to age 21.
Okay.
And once a child, even if it's an adult child that turns 21, then they would no longer have access to that waiver. So we try to get services in place during the transition period, which follows really that pathway for school districts, which is about 14 or 15. We start looking at transition services and what those will look like. Many children, when they're going 17 to 18, may have to have guardianship testing and that sort of thing to look at if they need a guardian in place to continue services. And so that's kind of a pathway that we follow. And then once they turn 21, we try to look at other services that we have that might support them in their home or community or wherever they're going to be. Prior to the age of school age, that's the best. Any time is a good time for applied behavior analysis services or any of our other services. But really, looking at the literature, that is the age prior to school age when you can get so much intervention time in. Applied behavior analysis is really known for intensive service provision, anywhere from 15 to 30 hours a week. And it was really designed for those little ones prior to school age where there is that time, perhaps during the day, where those services can happen. So we connect a lot with your services. So the Great Start Collaborative early on, our health department nurses, our infant mental health workers that are part of my team. We work with them. Sometimes they see a child that might have that need, or if they're working with an infant and the mother, they might see an older child. And so they'll try to make sure that they, support that parent in getting in for services as well. So I hope I've answered that. Just let me know if I haven't.
Yeah, I mean, I have so many questions, but so just talking about, you say either this ABA therapy or other services we provide. If you want to talk about specifically, we talked about the OT, the occupational therapy, and the physical therapy a little bit. Oh, and Caitlin is asking, so aside from ABA, what benefit does the autism waiver have? Or the autism waiver is just for ABA, so maybe if that doesn't have any benefit beyond that, if I was understanding you correctly, would you go for that? She's asking if you didn't want to do ABA, and if you don't want to do ABA, what other services are available?
So for community mental health, the services are a wide array. So ABA is one service. Not every child who has a diagnosis of autism is an appropriate fit for ABA for lots of different reasons. And it's really individualized for each child and their family. Some families are not able to commit to that high level of service, and that's okay. One of the things I love about Medicaid is that it's always parent choice. So you do not have to do ABA, even if 10 people tell you to. It's your choice as a parent, it's your child, and you're the expert. So you get to make that decision. And some of the things we provide are parent support. So that looks like we have case managers that are specifically for children and families that are kind of like that fulcrum. I look at it like they are the connectors and everything else is ancillary. So sometimes when children come into our services and families, that'll be their case holder is their child case manager, ABA, sometimes psychiatry, sometimes nursing, sometimes outpatient therapy, are all spokes out of there.
Okay.
But that person that is the child case manager really links and coordinates all services. That means that they are the person that can go with you to your IEP or to your MET to help advocate with the schools or provide a bridge.
Tell me,
between.
can you just get out of acronym world for a minute? Tell us what
I'm sorry.
IEP and MET stand
Oh,
for.
I'm sorry.
That's all
Sorry.
right.
So an IEP is an individualized education plan. So even before a child is school age, if you as a parent are involved in early on, you can get assessments through the early on program to see if your child might need an IEP. An IEP is an individualized education plan that allows you to have accommodations and supports that your child needs to be successful in the school, in their school day.
So this case manager might show up to those meetings with you to help
Yes,
advocate for.
100%,
Okay.
100%.
Awesome. And then you said MET. MET?
The MET.
MET.
So yes,
Okay.
I'm sorry. The MET, that is kind of like the schools, their big kind of assessment and multidisciplinary evaluation for what supports and services are needed in the school.
Okay.
So what someone needs in the school might be very different than what they need in the community or in their home.
Mm-hmm.
If a child has autism or learning disabilities or any number of things, sometimes they might need extra accommodations like preferential seating at the front of the room. If they are a child that has vision difficulties and low vision, they might need to have extra big print. So anytime a child has difficulty accessing their curriculum and learning just like anyone else, that's where they have an opportunity to have an individualized education plan through their
Okay.
school district.
And then you're saying, because we're going through the supports from CMH, so that support is really that parent support, the family support through the caseworker.
Case manager.
The case
That's
manager.
The case manager.
Okay.
That's one support.
Okay.
Sometimes children on the spectrum may need therapy. So it could be that they have a diagnosis of autism, but maybe they also have a diagnosis of depression or anxiety. And we see that a lot more in adolescents. And so it could be that, yes, they absolutely have that diagnosis of autism, but that's not what's presenting as a problem at the moment. It's that they're having severe anxiety or depression, and that's what needs to be addressed. So they can get outpatient therapy if that's appropriate treatment for them. It could be that they need psychiatry. Sometimes it's very common for individuals on the spectrum to have a co-occurring diagnosis. Co-occurring means something else along with. So it's very typical for people on the spectrum to also have a depression or an anxiety, or it could be obsessive compulsive disorder, or it could be PTSD. So they might have a trauma diagnosis. So they might have access to psychiatry to be able to support them with medications to help them with their overall functioning if that's what's needed.
Okay.
And along with psychiatry is nursing, so they get that as a package that comes with. We have parent support partners. Shauna Kasuba, she's amazing. She works with families, and a parent support partner is an individual with lived experience. So they have those range of diagnoses I was just talking about. They have had a child that meets some or all of that criteria. So they have lived experience, and they're not clinical. They come in alongside and they help you when you are exasperated and you have 10 meetings a week of how you're going to get to all of those. You know, I have PT, speech, I have OT, I have therapy. You know, they come alongside and just say, they're like a cheerleader. You are doing this. Way to go, you. You know, it's a
Awesome.
wonderful service. It's a wonderful
That is a
service.
great service. We all need more of those people in our
Yes.
lives.
Yes.
Yes. Oh,
That's right.
that's wonderful. Okay, so you mentioned PT and OT. Those are also services through CMH available.
They are not. They
Okay.
are not for children. Those are
Okay.
those are through schools.
Okay, so once they get into the school, then you'll receive those through the ISD.
Correct.
Okay. What else? Did we miss anything on the list of services?
You think we have infant mental health. So infant mental health are master's level clinicians that work with pregnant mothers or mothers with children up to age of 47 months. And so typically those are with mothers that are having difficulty, maybe postpartum depression, or have a history of a mental illness in some capacity that's going to make it difficult for them to have a clear attachment with their child.
Okay.
And so they work with us, and they often may see a child, like I said, who has an autistic spectrum disorder or a sibling, and they might set them up for supports with us. We have Children's Behavioral Services, which is master's level clinicians as well, and they are all very, very well trained in working with kids on the spectrum for many years. So they may be able to provide supports in the home or the community if there are behaviors that are getting in their way of being able to be successful at home.
Okay. And I mean, just going back to the very beginning, like, okay, I didn't know any of this before. So what I did was called the number that you said, and we'll put that in the, we'll share that in the comments there. So I called the number, and you did, you probably the person on the phone, which isn't you, I would imagine. You've got some people that do that with the 7 counties that, that look into that. But I do get a person. Do I get a person when I call? I guess that's
so. That's the access call. The first step is
okay.
The access call, and you do get a live person. They do that 15 to 20 minutes basic screen. What can we help you with?
Mm-hmm.
What's your insurance? Tell us the age of your child,
mm-hmm.
what you're looking for. And so if a person says, I think my child has autism, or my child has autism and I need some supports, what's going to happen is that's going to click it into place for my division.
Okay.
And so what happens next after that access call, if they are thinking you meet criteria, is you have an intake assessment. So you have 14 days from the time you call in to that access screen to have a master's level clinician come to you, or you come to the office for that intake assessment. The intake assessment is really, really in depth. It's about an hour and a half to 2 hours long.
So take a deep breath, because you're going to be...
Take a deep breath. But the reason why it's so fantastic, and it is a chunk of time, is because it's so in depth. They go from everything from pregnancy all the way to how old your child is now. That's so important.
So this will be information like that I know? Do I have to
Yes.
prepare for it? Do I have
Yes.
to bring like, okay,
No,
this is
no.
just, okay.
Sometimes if you have school records, if your child is school age,
Okay.
we have many children that go to DeVos or U of M quite frequently for other conditions. Any of those things are really helpful for us when we are looking through our intake. So that intake assessment pulls all of that information together, kind of like a puzzle, to say, oh my gosh, okay, this is what would be a really excellent support for you and your family. What do you think of that? And what are your ideas? And that intake assessment gets ready for a plan of service. So first is access, second is intake assessment, third is plan of service. The plan of service is at third meeting. It sounds like a lot, but we really have to gather everything to make sure we're getting you exactly what you're asking for. Because quite honestly, some people call and they don't know.
Right, that's what I'm saying. I don't even know what's, yep.
It's overwhelming. It is overwhelming. And so we try to be helpful every step of the way to get you where you want to be, and your child too. So that plan of service meeting is with the case holder. That's with the child case manager or a therapist. And they meet for about an hour just to talk about your dreams, goals, and desires that you have for your child for the next year.
Okay.
And so there's always an annual meeting that you have to look at those things because kids change rapidly.
Right. See if you still have the same goals, if you met any of the
That's
goals.
right.
Yep.
And you must have it once a year, but you can meet anytime. So that could mean in 6 months, if your goals for your child are different and they're hitting all of these marks, that is amazing. We want to reflect that to be able to support you better. So we can change those or amend them at any time.
So back to the intake, because I'm stuck on the private insurance and the age, the income eligibility, age eligibility, insurance eligibility. So if I said, look, I don't have Medicaid, then would somebody be able to kind of refer me to somebody that could help in a different agency or organization that does accept my insurance, so that my insurance accepts? Is that
Yes.
kind of part of the intake process?
Yes, that's exactly right. So sometimes we have people that have no insurance at all, and sometimes we might, depending on our general fund ability, might be able to support those people. We try to direct them to the marketplace, you know, to be able to get that insurance supports if they need help walking through that, if they've never done that before.
Okay.
That does happen. If
That's
they have a
also confusing and complicated.
it is very much so. And um, if they have a private insurance, we'll typically say, okay, so if you have Blue Cross Blue Shield, look at that number on the back, call them and ask them about your autism rider and what services are provided for you.
Okay.
So that's how that'll work.
Okay.
Sometimes people will call in and say, I was told to call in, but I don't want community mental health. And that's okay. And so we might say, okay, well, this is the provider in our area that I know does that. Here's a provider that may do testing for autism. Here's a provider that may work with children. Or if they have private insurance and they want to do ABA, here's a number of a provider company that does ABA that works with your insurance company.
And then you did mention, and maybe I'm confused about that. You did mention once my kid hits school age that a lot of those services will be provided. I mean, PT, OT, obviously, like you said, through the intermediate school district. Does CMH? But you also said that it goes through, 18 months or 12, 18 months all the way to 21. So, are there services like the therapy and the psychology, the psychiatry, the support person that can carry through the school years as well? Is there those services are
Oh, yeah,
still available? Okay.
absolutely. There are, not to use too many acronyms,
I
but
try.
many services that we provide, we classify under B3 services at this time. B3 services means outpatient therapy, psychology, case management, parent support partner, infant mental health, all of those things. You don't have to have a specific waiver for that.
Okay.
If you qualify, you get them.
Okay.
If you want them. If you don't want them, then you don't have to have them. So that's how that works. And that is regardless of the person's age.
Okay.
So some specific qualifiers, like for infant mental health, once a child turns 47 months, they're no longer eligible for that service.
For infant services.
Right. But and we don't work in the schools for any of these services, but we work with the schools. So, for instance, children's behavioral services or our outpatient therapists, even, we work with the schools. So we might go into the school for an IEP as children's behavioral specialists and say, what's working in your classroom so we can help model that at home? Or they might say, what's working in the home so we can help adopt some of those things in the classroom. And that's where it really helps to work with our system partners very strongly, because CMH is one part, school is one part, medical is one part, but we really have to work together to support each other.
Yes, it's the whole child, the whole community here. Um, okay, so we did have a couple of other questions we want to touch on, which involved SSI and the family support subsidy, and what that is, what that looks like, how that might assist families in accessing services. If you want to talk a bit about those.
Sure. So SSI so if a child comes in and a family comes in and that's something that they're interested in, our child case managers can help them apply for that and walk them through those steps. The family support subsidy is pretty wonderful. I think it's maybe, please, you can't quote it, but maybe about $227 a month, $227 a month. That is not tied to anything, but it's very specific criteria. And you don't have to be a part of CMH to get that. We just facilitate it. But it is out of a state fund that recognizes that if you have a child that has an autism spectrum disorder that's severe enough to cause a barrier for them to access school, home, and community, or if they have a cognitive impairment through the school, they should be eligible for these funds because it takes a lot of expense to raise a child with different needs. So what we do work very closely with the school with that, because the criteria is, I think in the funding, the parents can't make maybe more than $60,000 a year. And then they also have to have an individualized education plan and a school eligibility for that type of an autism spectrum disorder or a cognitive impairment.
So that'll start once you can access that once you do get into school. So it's not before school.
It's before school. So if we have children that are 2 or 3 that are in early on, and they age out in early on, just about 3, that have that school eligibility already, they can start getting that funding. And I do have a number for that if you want to put it in the chat. And so the family support subsidy is through 231 533 8619. And again, you don't have to be part of CMH to access that.
Um,
And that's until they turn 18.
okay.
And
And
so
so,
if you're 3, they
yeah,
may qualify up until, 18, that it's an annual renewal
okay.
that they go through and make sure the criteria is still being met.
Yeah, that's a wonderful service. So basically, that's just an income eligibility and a diagnosis eligibility to meet
Correct.
that.
Correct.
And we've talked about early on a few times here, and if anybody's interested in knowing more about that, we did a community connections a few months back with our local early on coordinator. So check that out on our community connections resource tab. That's early childhood support in the home and beyond, and getting you transferred. That's not the word. Transitioned into schools. So definitely check out about early on. And one of the other questions that we had was respite options if CMH provides respite, or if not, then also that referral to other agencies, organizations, options for respite for families.
So for people with Medicaid, when they're, or secondary Medicaid, when they're in our services, if they have that determination for a respite, they can get respite. We don't provide respite providers. That has to be done by the parent, but we do provide payment. So
Okay.
that's kind of how that works. So if a parent has a relative or a next door neighbor or someone from their faith community or whatever that is able to watch their child, then they can come through our services to be able to get trained. There's specific training like recipient rights, first aid, and those kinds of things that they have to meet those criteria for and complete before that they could get that money. But that's how that works.
Maybe I should have asked you to explain briefly what respite means,
Sure.
because maybe not
So
everybody's.
sure. Respite is a service that can be provided for children with different needs. Whatever, it could be behavioral, it could be autism, it could be depression, whatever. That if they meet that criteria, they could have the service of respite. And respite is an adult over the age of 18 that is not the primary care provider for that child that can provide supports. It's not babysitting. So some people think, oh, okay, this is great. They can watch my child while I'm going to work. It can't do that. They can be there when you're there. If you're doing things, they may be able to take that child out into the community and do things, but it's not meant to be like a babysitting service.
It's additional support, just to get
Exactly.
an extra a breather, a relief. So it sounds like
Yes.
if I have somebody that's interested in helping me provide respite for my child, I go to CMH. You can help pay them for that
That's
and
right.
also get them trained so that they meet the criteria for that.
That's
So
right.
is there a cost for them to go through those trainings? And
No, no, we provide those on a rotation, like on a monthly basis. So, once if they call in or you call in and say, hey, I have this person that I want to provide respite, that is great. We get them set up on our website through the trainings and get them all set for what they need to do.
is there a time, like how many hours a month do I get for respite care?
It depends. It's individual for each child.
Okay.
So some might have 10, some might have more. It just really
Depends
depends.
on
And
the
there's a
needs.
formulary that they use for each individual child. Like for instance, it makes sense if there is a child that has extra needs aside from like an autism spectrum disorder, maybe if they have a complex medical condition where they have a trach or, they're going to get a lot more than a child that does not have those things.
And since I mentioned the cost to every, for the respite provider and the training, so I mean, we didn't really talk about that. Sometimes people will have insurance and it covers part of something, or it covers a little bit, or it covers this service but not that service. So if I have Medicaid, and it sounds like, just to reiterate, I need Medicaid to access CMH services, um, what are the services going to cost? Do some cost me? Do some cost a lot, a little, nothing? How do I know what I'm going to be paying?
Sure, and it really, those things are kind of described individually through each intake assessment and plan of service. There is a standardized kind of fee agreement that they look at on a scale of what that they say that this might be your ability to pay. And that just depends on a lot of different circumstances, what you make as a family or as an individual, and other payment or things that you're getting, just similar to what you would for taxes or something like that. And there are certainly times when children end up becoming a Medicaid of one. So they are an individual Medicaid recipient of one, so then there would be no payment at all. But it really depends on each family and their circumstance.
And that's a big thing you just said. The child becomes an individual Medicaid of
I
one.
know
Can
it
you explain that a
sounds
little bit?
sure. So when a child has Medicaid, they have no ability to pay. And so we know, under the age of 18 and sometimes beyond that, if they have to have a guardian, they will always be that party of one. But it just depends for each individual child. And I think, and their family, sometimes when we do have people come in, like I said, they might have a private insurance of Blue Cross Blue Shield, and then that secondary Medicaid is because that child is a Medicaid
For the
recipient of
child
one.
specifically.
Yeah, and so
Okay.
what that means is that the parents don't have to get rid of their primary insurance. They can keep that, and their child will also benefit from Medicaid services. So that means that any services that are billed will always be billed to the primary insurance first, because Medicaid is always the
Right.
payer of last resort. So that can mean that there may be copays for different therapies or things that they're getting that go through their private insurance, and whatever doesn't get paid by that can go through their Medicaid to see if they'll pick up those deductibles or whatever,
Right.
that are remainders to be paid.
So kind of like dealing with, I mean, just to be blunt, anything in anything insurance related, you sometimes are just not going to know what it's going to
That's
cost you until it's been done. So
right.
it sounds like you do as much as you can to get some information out. And I imagine like I'm just imagining the plan of service meeting and saying, well, these are our goals, but what is going to be needed to do that, and what is that going to cost, and is it effective? So having those conversations during those meetings and making sure we can afford it. We all want to, of course, give our children every single resource available, but the truth of the matter is we can't always afford that. So it sounds like there's kind of ways to try to get as many services to them as possible. If anybody's here listening, I mean, you are here listening. If you have questions, comments, even just like quick shares about your experiences, you can put those in the comments. Really like to see those. I've been talking with you, Christine, for like 45 minutes already. And we've kind of gone through our list that we definitely wanted to cover today. I think we talked about, yep, the waiver. We talked about SSI, Family Support Subsidy. Trying to remember if there's anything else we discussed that we wanted to make sure we covered before we signed off. And if anybody out there has any questions or ideas, pop them in there. What would we forget? I mean, I feel like I'm sure we did, even though we've talked for. um, what do you think, Christine? Did we forget anything?
I don't know. I think we covered a pretty wide range. I think sometimes some things I hear from community members might be they have difficulty getting into
The,
CMA.
yes.
So I
Okay. Yep.
hear that one a lot, and I think people don't know. Sadly, we are kind of all in these systems, and this is how we do. We do our best to work with each other, but we don't always know what requirements or specifications are needed in each area. And for CMH, it really is that. They have to meet the criteria of an intellectual developmental disability or an autism spectrum disorder, or they have to have a serious emotional disturbance as a child. So those are kind of the two things. They have to have a form of Medicaid to be able to come in. Sometimes parents will come in and be very concerned about their child, and their child might have a mild depression or an anxiety that may not meet the criteria for our services. Our services are really for moderate to severe
Mm-hmm.
concern. And so it's usually moderate to severe or severe to more severe. So that might be a child who might typically get outpatient therapy. Their need might be high. They might be a child that's been hospitalized a number of times. They are blowing out of school, they're blowing out of home, they're blowing out of community. That's the level of service that we provide for these children. It's a high level of need. And then if it's just mild depression or something like that, that might be best served through a community provider. Or if they need medications, they might go through their PCP for that. So that just to let everybody
Mm-hmm.
know that is the reason. It's really reserved for that moderate to severe presentation.
Right. And I can understand that kind of just feeling of like hopelessness, like where do I go, what do I do, and so you reach out to this organization, they're like, well, we can help you, you know, and so it's like, okay, well, now what, you know, I thought you were the the place. So having those, like, those resources available when I do call, like you said at the intake, like, okay, we probably can't, you know, serve you at this time, but here's some places to go, and really making.
And that's exactly right. And we really work hard to do that at that first step, that access level. If they're not meeting the criteria, here are some resources so that you know where to go to meet your child's needs where they are.
We had a couple people saying thank you and great information. We also have one more question. Where can I read online about the Michigan autism waiver? It seems like that it always shows up as the children's waiver, but never any specific info
And
that I can
that's
find for
different.
the
And
autism. Okay.
that's not really the name. I'm
Okay.
just going to say it's not really autism waiver.
Okay.
That's
What
not
is the? Is there an official name?
behavior health. It's behavior health. And so BHP, behavior health. But
Behavior health. What's the P? Program.
hmm.
Okay.
And if you go to michigan.gov, you'll see information on there that can help you too, as far as specific for autism resources in the state and what is provided through our CMHPs, community mental health providers.
Okay.
So those are the best steps. And so you can have my contact information. And if you have any specific questions, whether it's Medicaid or non Medicaid, I'll do my best to help you. I really do talk to people in the communities all the time because this is the tough road. And I don't care how educated you are and how much information you have. When it's your child, it is very different. So please contact me, call me, or email me, and I'll help navigate as much as I can.
Yeah, awesome. And I feel that, and I just want to personally vouch working with Christine for this over the last few weeks. Has been a real pleasure. Very personable, friendly, willing to handle the hard questions and with grace and understanding, and having that lived experience really does matter. So thank you for everybody who asked questions, and we'll be calling on Christine in the future to make sure we get any more questions answered. Really appreciate you guys popping in today and watching, and really appreciate you, Christine, the work that you do, your whole team, and being here with us today to kind of put it out there into the world. So thank you very, very much.
Thank you so much for your time, and thank you so much for letting me be part and just share what we do. I'm really proud of the work that we do. And if anybody needs to know anything, it's that we have an amazing team of individuals that are dedicated to supporting you and your family.
And it comes across. So thank you, everybody. Have a wonderful weekend, and if you're watching this in the future, have a wonderful next weekend. So we'll see you guys later.
Thank you so much.